Good morning. My name's Greg Tester, and I'm an interventional cardiologist with SSM Health, Dean Medical Group in Madison, Wisconsin. I'm honored and privileged to stand before you today to share my experiences and thoughts regarding the power of presence and how it shaped my life. The word presence literally means the physical act of being present. However, as I thought about this definition doesn't encompass the presence that we speak about and act out every day at SSM Health. Our presence is not merely being physically present in a place, but instead it depends on how we occupy that space. It's how we act, speak, listen, and behave. These actions then coalesce and translate into how we make other people feel and ultimately how we support and inspire them. And do we have to physically be present for someone to feel our presence? I don't think so. These feelings and inspirations are not just limited to that moment, but they are carried with people long after the encounter. In my experience, the presence that we are speaking about is a feeling or inspiration that continues on even in the absence of being physically present. The power of our own presence exists both in the immediate moment that we are with someone as well as long after we have left. In some of the strongest instances, it can take the form of a lifelong feeling of hope, support, or inspiration that is generated and carried with others. I can speak to the power of one individual's presence in my life and how it's had a profound effect on me. On May 1st of 1985, my brother, Brian, was born, and my life would be changed forever. My brother was born with a congenital heart defect called congenital aortic valve stenosis, which is a narrowing of one of the heart valves that limits the blood flow out of his heart. This became readily apparent as he required open heart surgery only days after he was born to relieve the narrowing. Following this, Brian lived a relatively normal life, but required multiple doctor visits and checkups. Through his multiple visits, tests, and procedures, I always marveled at the healthcare providers and how understanding, attentive, and supportive they were. Based on the positive impact that his team had on him, I knew that I wanted to be involved in healthcare from an early age. In his early years, his valve repeatedly re-narrowed, and he required several minimally invasive procedures to relieve the narrowing. And around the age of 8, he required another open heart surgery to replace his valve with a mechanical valve. Through all of this, he kept an ever positive outlook on spirit. He might get short of breath with some activities, but it never stopped him from participating and enjoying every moment of his childhood. Not to mention, he always beat me at a competitive game of horse. Growing up, we were the best of friends and inseparable. He may have been the younger brother, but I always looked up to him, given his optimism and strength. Unfortunately, on August 9th of 1997, at the age of 12, my brother suddenly passed away in his sleep at home. This was an unfathomable event for me at the age of 14. However, with the aid of my parents, family, and friends, we were able to traverse this difficult time. When things got difficult, I was always reminded that we had to be strong like Brian. He would have never wanted us to be sad on his account. Rather, he would have looked for the positive. Thus, we remember the good times and are thankful for the times that we had with Brian. We all feel lucky to have been touched by him and to carry his memories with us. Every day, I feel Brian's presence as I think about his optimism, strength, and happy and loving attitude. Long after Brian was gone, he continued to have a positive effect on my decisions and actions. Based on my experiences with Brian, I always knew I wanted to do something in healthcare, and when given the opportunity to go to medical school, I was elated and entered with great enthusiasm. Entering into medical school, I had anticipated that I would become an orthopedic surgeon, as I'd always loved sports and I loved prior anatomy classes. I had made a conscious decision not to even entertain the possibility of entering the cardiovascular medicine field, mostly because I didn't want to relive any of the hurt or pain that I had relating to cardiovascular disease. Now, I've already given away the fact that I'm an interventional cardiologist, so obviously this didn't last long. Through my training, despite my own conscious efforts, I always felt a calling to cardiology. I found myself spending extra time studying how the heart works, cardiovascular pathophysiology, and all the possible ways of treating cardiovascular disease. This led to me taking electives in cardiovascular medicine, which confirmed my passion and ultimately led to a career. I now have a keen interest as an interventional cardiologist in transcatheter aortic valve implantation, which is a minimally invasive procedure to replace the aortic valve as an alternative to traditional surgery. This is done so patients do not have to experience the difficulties, pain, and prolonged rehab that is encountered with the traditional open heart surgery, much like the one my brother had. I think in some way, by treating cardiovascular disease in people with medical conditions similar to my brother's on a daily basis, it's my way of continuing to help Brian. I know the 12 years that I lived with Brian had a profound effect on me. He taught me to cherish what you have, live in the present, always strive for the best, and always to be there for those in need. The fact that he plays a huge role in my life, even to this day, is an understatement. Though I wish with all my heart that he were here today, I am thankful for the life that I have, thanks to him. There isn't a day that goes by that I don't think about Brian and feel his presence. I take solace knowing that he walks in this journey with me every day. As a healthcare system and healthcare providers, we are given the great opportunity to have profound effects on our patients' lives. Not only are we allowed to provide medical care for people when they are unwell, but we are also in a unique position to provide reassurance, guidance, and support through some of their most difficult times. It's our responsibility to care for our patients in the most humanistic way possible. Through our medications, procedures, and caring and supportive interactions, it's our role to foster positive change in our patients' lives that they will carry on with them long after they've left the office, the hospital, the procedure suite, or the operating room. Through our actions, our presence should be felt as an ever-present feeling of hope, support, strength, and inspiration, much like my brother Brian is yet to me today. Thank you.